Well, good evening and welcome to the Tuesday evening, January 26th, Washington County Board of Commissioners meeting. Mr. Moss, roll call, please.
Thank you, Chair Harrington. The Washington County Board of Commissioners also meeting as the Board of Directors for Clean Water Services and all other service districts is now meeting in regular session this evening, January 26, 2021. Commissioner Fye.
Here.
Commissioner Willie.
Here.
Commissioner Rogers.
Here.
Vice Chair Treese.
Here.
Chair Harrington.
Here. Thank you. The first item on our agenda is oral communication. Mr. Moss, do we have anyone signed up to testify this evening?
Yes, we do, Madam Chair. We have Mr. Dale Feek. Dale, can you hear us?
I can, Kevin. Can you hear me?
Yes, we can. Please go ahead for up to 2 minutes.
Thank you. I'm glad we have a timer. I recommend that the Environmental Quality Commission do the same thing you do. I'm Dale Feek, Chair of Washington County Citizen Action Network, coalition of grassroots advocates dedicated to improving the quality of life in Washington County by promoting healthy and sustainable communities, social and economic justice, and open and responsive government. And I'm glad that I'm able to interact with Multnomah County Commissioners and the Environmental Quality Commission, as well as you, Washington County, my commissioners. I appreciate it very much, as you are good public servants. I sent you an email about the Environmental Quality Commission email that I sent to Richard Whitman and Environmental Quality Commission Chair Kathleen George and the other commissioners. And also I forwarded that to the County Commission Chair, Deborah Kafori, and those commissioners. It's information for you. I hope people will follow through, because the staff at the Environmental Quality Commission put a lot of time and effort, and Richard Whitman put extra hours on the weekend to write his director's report. And I included a link to that director's report, or I guess maybe I made it as an attachment. And he had it in 3 categories: changes in federal administration. He talked about that. And you can read what I said there. And then he also, which I think is more important, the Biden-Harris transition, 104 specific actions. This is a non-exclusive list of agency actions that heads of the relevant agencies will review in accordance with this executive order. It has relevance for your directors of legislation and also both of the county and clean water services. The third thing was the Oregon Environmental Protection Act, the summary tractor legislation. And I'm assuming, again, your legislative directors and people involved in legislation will want to study and become very knowledgeable. I just wanted to have you informed of that. And I enjoyed shoveling snow. I did that after your work session and whatever. All right, thanks.
Thank you, Mr. Feek. And I hope you shoveled snow safely. All right, next we'll move on to the consent agenda. But before we do that, I just want to make sure I announce updates to our packet as it was republished on Friday. The packet for item C under actions, boards and commissions, appoint members to the salary commission has been updated. On the consent agenda, item D, which is under land use and transportation, was updated to include the award memo. And those were the only changes to today's packet versus the first published packet. So today's consent agenda consists of at least 8 items, 4 under land use and transportation, including that item D, award memo. 1 item under health and human services, 2 items under support services, and 1 item under service district for lighting. What are the wishes of the commission for the consent agenda today?
Move for approval.
Okay. We have a motion and a second to approve today's consent agenda. All those in favor, please vote by saying aye.
Aye.
Any opposed? The motion carries unanimously 5-0. Thank you, commissioners. Next up, we have a presentation on COVID-19. And I believe we have our Director of Health and Human Services, Marnie Kyle, with us tonight. who will give us an update. And there are several things that have happened. So thank you, Marnie, for joining us. It's always good to have you.
Thank you. Good evening, Chair Harrington and board. I am just going to warn you, there's a lot of information this week, so I will try to move through it for you. But I also want to make sure that we address all your concerns and answer any questions that you have. So we can go to the next slide. So as normal, I just like to start with an update on where we are with our statewide case count. And you can see that we're just under 139,000 cases cumulatively in Oregon. And our cumulative state case rate is 3,230 cases per 100,000. Never imagined that last February, and we'll talk a lot more about our one-year anniversary, the kind we don't want to celebrate next month. Unfortunately, 1,882 Washington County residents have lost their lives to COVID-19. Very sad. And the statewide 2-week moving average for new hospitalization is 195 hospitalizations per week, and that's down slightly since the last time that we did talk. So we can go to the next slide. So this is the county, the Metro County metrics, and a little bit of good news here. You can see that each week our cases per 100,000 have gone down. And in the last 2-week time period, we were down to 289.4 cases per 100,000, and our test positivity is also going down. So that's good news. We just need to stay vigilant so that we continue to see these numbers go down. And you can see that that is true also of our neighboring counties in Clackamas and Multnomah County. So next slide. So I wanted to give you an update. This is hot off the press. Late yesterday, we learned that the governor was making announcements and did make an announcement regarding changes to the current sector guidelines. And this applies to the extreme risk category, which I'm sorry, Commissioner Rogers, but we still have to refer to it as extreme risk. But the good news is there is some changes based on what we've been learning. So we've been saying all along since March, we learn over time about this epidemic, and we learn what's highest risk and what behaviors reduces risk. And so because of what we've learned, there is some loosening of some of the guidelines. So for example, right now, indoor entertainment right now today, indoor entertainment is prohibited, but as of 1/29 for establishments that have 500 square feet or larger, they are going to allow a maximum capacity of 6 people. That also allows for smaller capacity, that there could be things like personal training that's happening for one-on-one training. So there is some loosening of the guidelines, really steeped in the science and what we're learning. Also with a lot of stress about the importance of still maintaining physical distancing, the cleaning regimens, and wearing our face masks when we're around people that are outside of our household. So next slide. The other change that I believe that I shared with you via email, but just wanted to revisit today, is some changes to the school metrics. One of the biggest changes is that this is really now considered a recommendation and not mandatory. And a new category was added that would allow or recommend that it's safe for elementary on-site or hybrid transition learning to happening at the schools. And if you remember, our case rate is below that 350 per 100,000. So when you look at this chart, Washington County is in the orange zone, which does indicate that it's safe for some elementary age group on-site or hybrid learning. We can go to the next slide. So now I wanted to transition quickly to information that you've probably been hearing a lot about in the news, which is the SARS-CoV variant concerns. We heard a lot beginning in September about a new variant that was discovered in the UK. And so we're over time learning more about this variant. And what we seem to be learning is that it does appear to be more highly transmissible, so it's easier to transmit from person to person. It could be as much as 50 to 80% more transmissible. But the good news is, this is mixed news slide, but the good news is that there's no evidence that it is more severe or more deadly than the SARS-CoV COVID-19 virus that we're all used to talking about. But if it's more transmissible, there could be more infection in the population, and because it's not more, because it's not less severe or deadly, there could be the potential, if this variant was widespread, we could see a potential of more hospitalizations and more deaths related to it. But it has to do more with more people getting it than that it's more deadly, if that makes sense. So there are some national estimates that this could be the dominant strain in the United States by March. And so we're working really hard to reduce transmission with all of the tools that we have, which we'll talk about next. But right now, as of this afternoon, there's been 3 cases identified in Oregon, including 1 case that was identified in Washington County. So next slide. So the other thing that we get asked about this new variant, and the other thing I wanted to say about the new variants is there's multiple variants. So there's this UK variant, there's a South African variant, there's a Brazilian variant, and it's common for viruses to mutate over time and to change over time. And so it's not unexpected that we would see these new variants, but it's something that we really want to watch closely because COVID-19 is so widespread. There could be mutations that are happening more quickly than you would see in other viruses that aren't spreading and aren't so prominent in the society, because the more it's transmitted, the more people that have it, the more likelihood that there's going to be mutation at some point during that transmission and infection. So we know that there's multiple variants that are spreading globally, but what we also are seeing, at least so far, and I just keep reminding you, remember how different our understanding of COVID-19 was back in March. So this is very early, but what we are seeing so far is that the vaccine does seem to provide protection against these new variants. So I just wanted to let you know that. And because we have these variants and because we're worried about their being so highly transmissible, it's more important than ever for people to wear a mask, keep distance from anyone that's not in your household, stay home if you're sick, frequent hand washing, sanitation, and when vaccine is available and you're eligible, to please get your vaccination. So I was going to stop there for a second and see if you have questions about the variants. Sorry, go back 1 slide maybe.
I have one question. It sounds like as this mutates, you could have multiple variants, as you call them. I mean, this might be just the first of many. Am I misunderstanding that?
No, you are understanding it, and there are multiple variants circulating right now. We don't know that they're in the United States or in Oregon. It's likely that they will reach the United States and Oregon, but you're correct. Any other questions? Okay, so then we can go to the next slide. This is kind of shifting now towards what most of my comments will be directed for tonight. So I'm switching into the vaccine issues and concerns. So I just wanted to remind you that right now we're people that are eligible fall into phase 1A or phase 1B. And phase 1A is the groups that we've been talking about for a long time: healthcare and hospital staff, long-term care facilities, hospice programs, mobile crisis services, home care services, and then ancillary healthcare services like dentists, ophthalmologists, physical therapists, or community health workers. So all of the large definition of healthcare worker or medical field, including our first responders and law enforcement. As you know, this week, the governor has added phase 1B, group 1. So childcare providers, early learning staff, and K through 12 education staff. So we can go I just wanted you to be reminded of that. There are approximately 105,000 educators within the state of Oregon. And it's estimated that when we look at our staff here that fit into group 1, phase 1B, group 1, in Washington County, in the metro area, it's about 66,000 educators that fall into that category. So just to give you an idea of the numbers. And what we know is we still have approximately 70,000 phase 1A healthcare workers who are waiting for their vaccination series. So just to kind of ground you in what's left to be done in phase 1A and phase 1B. So go ahead to the next slide. So our focus, obviously, this week of January 25th is to continue to focus on the 1A, the healthcare workers, emergency responders. We also have had a lot of activity, and we have vaccinated over 500 people that fall into the intellectual and developmental disability category of either receiving those services or caretaker for people that are receiving services in a care setting or in their homes. Commissioner Willie?
I'm sorry, I wanted to go back to the previous slide because the questions that I'm getting, part of them apply to this. So, because it seems like there's been a lot of people that are getting vaccinated, but really don't fall under group 1 in any of the categories. So probably two questions. One is, since teachers have now kind of slid into that group 1 category, how are we going to provide vaccinations for them? Even if we had the vaccine, where are they to go to get vaccinated? And then the second question is that I was told that I qualify for vaccination right now because I am older than 68 and I'm a veteran. And you don't see any of that in the definition. So could you answer those two questions?
Sure. So the question about educators, if you can hold off a little bit, because I have several slides that I hope will answer the questions about where people in phase 1A and 1B can go. The question about your status as a veteran. So part of what's happening is Washington State has slightly different phases and priorities, and they're prioritizing people over 65. And the VA, the Portland VA, is vaccinating veterans in that age group in Clark County. My understanding in Oregon is that the VA for residents of Oregon is following the governor's eligibility and priority lists. And so since you shared your age, you would likely, unless there's other things that I, of course, don't know, be eligible towards the end of February, 1st of March, when we move towards phase 1B group 5.
Okay, all right. Well, interestingly enough, I got that information from a Washington County staff. So there was no reference to going to Clark County to get the shot.
Yeah,
But
I don't think you'd be eligible in Clark County because you're an Oregon resident. I'll double check, but my understanding is the VA is following the governor's recommendation, but because they're federal, they may be following the federal guidelines, which prioritize anybody over 65. So I
Okay.
will double check on that one.
okay, yeah, I think and you know, personally, I don't, that's not a priority to me, but I think that's like I said, the number one complaint that I get is that there isn't any real clear cut who qualifies, who doesn't qualify, and why did you get it when you don't qualify in any of those categories, but I don't qualify.
Right.
So
Right.
yeah, there's just a lot of bad information out there, and I don't know how we clean that up, but I sure wish we could.
Yeah, that's helpful feedback, especially from the perspective of being a veteran. I think that is unclear. So thank you. So we'll move on to the next slide after this. Thank you. Perfect. So I mentioned this earlier, but when we look at the education sector in the metro area, there's based on data we're receiving from the school districts and from the early learning division, there's approximately 66,000 or more who are eligible in this category. But remember, we have a limited supply, and it's estimated that based on the supply that we're getting in the metro area, that it will take at least 4 weeks to vaccinate, and that's to vaccinate about 56,000. So it's not even the full number that we're receiving. And so the schools have agreed to a planned approach that starts, and we've already started this today, starts with the preschool through first grade. And basically what's happening, and then you can see second grade through 5th grade in week 2, and then middle school, and then high school. And so what's basically happening is that they're receiving a link from their school districts and OHA that says, go to this bot. And I'm going to talk a little bit more about that, where we determine eligibility, and then they're given a link to make an appointment. So we'll talk a little bit more about that. So we can go to the next slide. So just a quick reminder who's included in the education phase 1B. And remember, we're starting with preschool through first grade, but it's anybody that works in the early learning or childcare sector, including center-based, emergency providers, and home and family-based providers. And then schools includes public, private, and charter schools. And it's everybody that's involved in helping our students to learn, from the teachers, teacher's aide, student support staff, health staff, nutrition, janitors, bus drivers. And then last on the prioritization would be administrative and district staff. So we'll go to the next slide. So once we move past educators, in early February, we will start with the governor has determined that our seniors will be eligible. And I'm really stressing the word eligible, because eligible doesn't always equal vaccine is available. So we're asking everyone, just because you're eligible doesn't mean that we can get you an appointment in the next few days. But the governor's rolling out eligibility on her recommendations and timelines. And then and it's the same kind of staging that I just talked about with the education staff, where we're starting with the 85 and older, and then we're moving to the 70 and older, and moving down the age range, which will take several weeks. And beyond that, the Vaccine Advisory Committee is really prioritizing using really equity-focused recommendations. And so as we start to define who's next, we get into that category, that sort of broad, fuzzy category of essential workers. And the Vaccine Advisory Committee will help prioritize essential workers through that equity frame, really looking at who is most impacted by COVID-19. So we can go to the next slide.
Marty, Chair Harrington has a question for you.
Oh, sure. Thank you. You're on mute.
Thank you. On slide 12, the slide mentions seniors 85 or older, yet on slide 8 with the chart, it talks about the first age group being 80 or older. So I just wanted to double check. Will that first tranche of the senior age groups really start with 85, or am I just missing something?
No, you're detecting a typo of mine that nobody else caught. So it is 80. It is 80. Yes, thank you.
No worries. We're all in this together. Thank you,
Yep.
Marnie.
Okay, so now vaccine clinics that have started this week, and as I move into sharing a little bit more about these clinics, one of the things that applies to every single thing that I'm going to talk about now is all of these clinics are by appointment only, and they're only for specific populations that have received a link that has said, go in, you're eligible, and fill out this form and make an appointment. So we're asking everybody to follow these guidelines so that we can get through these different priority groups as efficiently and quickly as possible. We are hearing about people that are going to some of these clinics, and they go there and they stand in line or they drive in line only to get up to the front of the line and be told you're not eligible because it's by appointment and you have to be on the list. So we can go to the next slide. So right now, as we speak, these clinics are happening. Oregon Convention Center is the bulk of where our health systems are combining their resources. And the reason they're doing that is because at this point, the two populations, educators and the healthcare community in general, has access to transportation and the ability to get to the convention center, and they're able to do multiple hundred vaccines per day by combining all of their doses versus spreading it out and only being able to do a few hundred at a time. So they're cooperating. All of the health systems are working together to make this happen, including adding clinics out of the Portland airport. The focus and the only people that are eligible are the education sector that we've talked about, and continuing to vaccinate the phase 1A. One thing that I'll also remind folks of is you go to the same place to get your second dose that you went for your first dose. So there's also still vaccine clinics happening at the health centers. So you don't go to OHSU for one vaccine and then go to, I don't know, TVFNR for your second dose. You go back to wherever, to the same health provider that gave you the first dose. So we're working to open more mass vaccination clinics beginning on January 30th in Washington County. And we're finalizing a couple of different sites that are not necessarily Hillsborough centric. And because we're still working out the final details, I can't share a lot more about it, but we're very close to adding other sites in Washington County. And then we also have the Hillsborough Stadium, which is now being run mostly by Hillsborough Medical Center, which I still have to remind myself that's what we used to all call Tuality. So they are opening, and their clinic is open in the evenings and on the weekends. In addition, because people have to go to the same provider that they started with, OHSU is still providing some clinics and some testing at the stadium for those second doses as they transition towards being at the PDX and Oregon Convention Center. So next slide, please. Okay, so a little bit about the new scheduling tool. And I know at least a couple of you have been asked, is this real? And I had to dig into this a little bit myself because I hadn't seen this. And part of the problem that's happening is people are getting this information. So maybe you qualify because you're work for a school district and you're a kindergarten teacher and you get this and you want to be really helpful to your best buddy and you forward this link on. And if somebody just Googles the links, or if somebody gets this link forwarded to them, they'll see that little red box that said all appointment types are private and none are available for scheduling. And so they won't be able to get on and schedule if they weren't given the direct link because it's linked to a person. Don't ask me how that magic happens. It's something about bots, but it is a system that OHA and the school systems have used. So all appointments are private and they're only for the specific groups, and eligible people will receive a specific link. So like for educators, for example, Commissioner Willie, you were asking about it. We have names that are coming to us from the school districts, the schools, the principals, and those names are getting prioritized based on their, whether they're pre through first grade or second through fifth grade, and names are getting submitted. They'll get this link. They go on to this link, they fill out a form which says, yes, you're who you are, you're eligible, and then they get a direct link to make an appointment. So we can go to the next slide. So that's sort of the broad overview of vaccines and the mass clinics that are really focused on the 1A and 1B. In addition, you've heard that the county health department, our focus is really on equity and how do we ensure that people that aren't able to get to those mass clinics. So even within the education sector, there are going to be some people that for whatever reason, mobility, whatever reason, can't go to the Oregon Convention Center. So it's our role to figure out what is the backup plan. And so that's what we're working on. So one of our partners that we wanted to highlight is Virginia Garcia. They completed vaccinating their own phase 1A staff, including traditional health workers. And now they're working with our community-based organizations. And these are just 3 examples of the community-based organizations they're working with to identify people that are either in the education or childcare sector or healthcare workers, community-based, traditional healthcare workers, because they qualify under 1A. So the next slide. So the other partner is the Hillsborough Medical Center, and they have really helped us to do outreach to the intellectual and developmental disability community, including caregivers. And one of the things that was great about this partnership is they had received some of the Pfizer vaccine, which Pfizer vaccine can be used to vaccinate people that are 16 to 18, whereas Moderna, you have to be over 18. And so we were able to vaccinate those 16 and 17-year-olds that are part of the intellectual or developmental disability community. So that was a great benefit in the partnership. We filled 400 spots within 2 hours because of a collaborative effort between public health and Collins Fitzgerald and his staff in our developmental disability program. So that's how quickly that went. In addition, we are planning some drive-throughs for people who are medically fragile and receiving home health services and their home health care providers. So that is continued work to help with those communities. And then the last is our partnership with TVF and, oh, sorry, next slide. Our partnership with TVF&R, who helped provide the vaccine to the intellectual and developmental disability community that we talked about. And today and Wednesday, they're providing 500 vaccinations each day to this community. So in addition to what's been done, and really helping us as we identify these pockets of hard to reach communities, they're really helping with recruitment and scheduling. That when public health does the recruitment and scheduling, we can connect them with TVF&R. And then lastly, our public health medical reserve corps, which I'm happy to say I finally finished all my training and qualified for. Yay! We had the Medical Reserve Corps finish their training. They did an exercise and then immediately did a clinic where they vaccinated Medical Reserve Corps volunteers who will be working the vaccination clinics, and also some community members who fell into the phase 1A and 1B. So there's been a lot going on. I know we're all inundated and bombarded with all of the information about who's not getting vaccinated yet and who's struggling, but I just wanted to really spend some time sharing with you all that is happening right here in Washington County. So we'll go on to the next slide. So you probably care a little bit less about statewide data, but when we do look statewide, there's been over 308,000 people that have received at least one dose, and 40,775 people that are fully vaccinated in Oregon. And the next slide is Washington County. And I wanted to just sort of remind you, in Washington County, the total population is 613,000, and 263,000 people have received at least one dose of vaccine. So that's pretty good when you see that. I think it makes us feel a little bit better about the progress. One thing I'll point out on the graph, because I had that question, is it looks like we're vaccinating fewer people at the right end of the graph, the far end of the graph, the latest date. And that's because it takes 24 hours to get information in the system. And it's a system that we put every vaccine in, MMR, flu vaccine, every vaccine goes into the system. And so there's always a lag of several days. So those bars on the end of the graph should go up because we're not vaccinating fewer people per day. So I just didn't want you to think it was going down in those last few days. And then just a reminder, this was a lot of information. There's a lot of information on our website, but just a reminder to really encourage people who have questions to check out our website. We have both an English and a Spanish page that's completely dedicated to vaccines. And as people become eligible, there is a link so that people can fill out forms to submit their names as eligible or learn more about their eligibility. And that is what I have for you tonight. I know that was a lot, so thank you for your patience, and I'm happy to answer any questions.
Commissioners, what questions do you have for Marnie this evening? Or comments? Doesn't have to be just questions. Go ahead, Commissioner Treese.
Marnie, thank you very much for your presentation. As always, it's full of information that's very useful. The question I have is really a question of you and just your thoughts here. What we're working toward, we all know, is the herd immunity status. Is the receptivity of regarding the vaccine higher than we expected? It seems to me that, I hear from people who want the vaccine, not from people who don't, but overall, is the expectation that we will be able to vaccinate a high percentage of the population? Has our expectation increased?
So I don't know that the expectation is increasing or higher, but there is more demand than there is current supply. And so people that want it now, and I don't blame them. I do too. And I want it now for my 95-year-old mom in Arizona. So I get that. But most of the polls that I've seen have been in the range of about 70% of people that want the vaccine. That's not consistent across every single poll, but a lot of employers are polling their staff, and that's roughly what I've been seeing in most of what I've read.
And what do we need to be at for protection across the community?
Yeah, what I've been reading is 70 to 80% of the population needs to be vaccinated. So there's still a lot of work to do. And I had so much to share. I didn't really get to talk much about what we're doing to try, because we're also at the same time working on the vaccine hesitancy problem. And so we have some great, I really wanted to show you, we have some really great videos of Spanish speakers, but it's got English subtitles that I wanted to show tonight, but I just had too much to go through. So I would encourage you, it's on the website, to hear some of those stories, because they're very moving. And it's messages from different communities about why it's important to take this serious and to get your vaccine. And then we have a one-page flyer that's really helpful that, and I don't have it in front of me, but really shows that even in the vaccine trials, that there was diversity, that a certain percentage that was relative to the population of Black or Indigenous folks or Asian descent. So there was, during the trials, it wasn't sort of the old, what a lot of people fear and what has happened a lot in research is middle-aged white men. And this had a lot more diversity. And so I think people can feel really confident about the safety of the vaccine.
Thank you.
Mm-hmm.
Marnie, I thought I read in the state email yesterday and then again today that fitness centers were going to be allowed to be open, provided the number of space and the head count and all that kind of stuff. And I thought I read in one particular part, it said they can have one person per 500 square feet. And another one, it just said one. So am I going to see the fitness center? I mean, like, I belong to LA Fitness and haven't been able to go there for a long time.
That's, oh, thank you. Somebody put, it's slide 4, and it does apply to fitness centers and other indoor sort of entertainment and fitness. So gyms and K through 12 sports, fitness organizations. So if they have 500 square feet or more, they can have a maximum of 6 people. That doesn't include the employees that are in the space at one time. And where you saw the one person was that if it's less than that, then they can do like one-on-one training. So there's some concern already from fitness organizations that this really only applies to the tiniest gyms, which is probably true to some extent, but it is some new access to fitness centers that we didn't, and other indoor entertainment that we didn't have before this goes into effect.
And this goes into effect Friday. Is that
Yes,
correct?
the 29th.
Okay.
Yep.
All right. Thank you.
3 more days.
It's also swimming pools, right?
I think swimming pools were already, I can double check, but I think they were already added to some extent if you, for some activity, not like just open swim, but for lap swims with spacing. I believe that was already done a while back, and Commissioner or Chair Harrington is shaking her head yes, so she has a good memory too. I don't remember exactly when or exact rules, but there was some loosening of swim centers earlier.
Thank you.
Mhm.
Commissioner Rogers?
Yes, Marnie, it's always good information, as we all said, and you spent always a good deal of your time, which we're appreciative, talking about these issues. But if I'm correct, there's only about 40 people on this whole meeting tonight. That's not money out of 610,000. If we, with our outreach folks, thought of a way that we can continually broadcast, make people aware, because you have a tremendous amount of good information that I think people would like to poke at other than just at our meeting. So I still encourage you to see us. I'm not disappointed in that at all. I'm just thinking, how do we reach a whole lot more people than we reach at one of these meetings?
Yeah, it's, I think it's a challenge, to be honest, to get some airtime in the metro area, because Portland gets a lot, but a lot of this is regional. I think we're doing our best to get it out on social media and through our webpage, and trying to share talking points. I think last week I shared some talking points with all of you, so that on all of your pages, you can also share the information. We have, Chair Harrington convened a mayor's meeting where we also provided them this information, including, I believe the talking points were shared with the mayors as well. And then I believe on Friday, we're meeting with the city managers, and we have sent them, we've already sent them some information that they can share on their web pages and on their social media posts. And then, of course, for a lot of our community, we work with the community-based organizations. So a lot of the organizations that you've been hearing about, Families in Ascension, Somos Media. We've been working with the Muslim Educational Trust to get out information. And thank you, Commissioner Treese was a speaker to kind of help strengthen that relationship. Centro Cultural, Adelant. So a lot of the community-based organizations in Washington County are getting information out via their websites and their social media, their Facebook and their, Twitter and all. Yeah, there's a lot of new ones that I don't even remember anymore. Makes me feel old now. But yeah, I mean, we need to do more. I'm not disagreeing. That's always the challenge, is getting the information out to everybody.
Well, and I'll add that the state is putting some additional effort behind the communication and the outreach as well. They've committed to that. They assumed, or they responded, that it'll take into February to put all of that together. I just checked in with Leah Horner on Monday evening and shared with her the request for that I'd heard from Virginia Garcia folks on Friday about trying to get information pushed out via Univision's TV channel to reach more of the Latino older, especially the older community members who are not tied to the internet like like many of us, as well as our younger population. So there's a lot in the works, more
then-
effort needed.
Yeah, and then I think, the other big place that we try to share information is through our faith-based, through the churches and synagogues and mosques. We push information out to them as well and ask them to share it. But some of it is staging it and not setting expectations that you can get vaccines and, trying to, just share that it's coming. It's coming.
Commissioner Fye, did you have any questions or comments for Marnie?
No, Madam Chair, I don't. Marnie and I had our debrief yesterday on COVID, none other. So
Great. Well, then I'll do sweep here. I've already mentioned the Univision Avenue, but before that, actually, Marnie, I'm not sure that I clearly understood what you were hoping I would understand with regard to mass vaccination efforts here in Washington County. I had understood that as the local public health authority, that you and your team were working with TVFNR, the Medical Reserve Corps, and others to make sure that those special, what I call special populations, have reasonable accommodations that they can reach here in Washington County. What I'm concerned about is the slide that talked about, gave an early indication that there will be something available January 30th. And I'm feeling that it was a bit of a tickler or a tease, and I'm not sure I'm prepared to navigate questions, hypothetical questions, between now and then. So I didn't note the slide number. It's not this one.
It is slide 14, I believe, that you're talking about. Yes.
There you go.
And yes, I apologize. It is a little vague because we are making some. We know TVFNR went and did some site visits, and we don't have a site yet to share, but we.
So we should just hold. Let's not pre-announce something until it's squared away.
Yeah. Yeah, that's good feedback. Yeah.
Oh, we have enough uncertainty out there for folks and enough frustration for folks being eligible but not having enough doses. Let's not shoot ourselves in the foot or bite our nose off to spite our face or whatever. Let's not overburden ourselves with more mystery and intrigue until we have a clear program and a clear message. Thank you for making sure I got that. The last thing is, well, actually, there's two things, sorry. Second to the last thing is, last night and then again tonight, I made an effort to tune into some local news programming, and I appreciated how you explained that the groups in that fall into the education and early learners will receive information that directs them to what links and so forth they need to follow. What I saw in KGW tonight was a reporter after today's announcement that walked us through going to the covidvaccine.oregon.gov site and walking through a series of questions as though they are part of phase 1A or group 1 of phase 2B, phase 1B. So there was no bot in that case. It wasn't a special email. It went right through the front door of the Oregon COVID vaccine website. So I'm a little confused now, hearing one thing, but having seen that walkthrough.
Yeah. So my understanding is that people are getting direct access to the bot. And when they get that, it is answering the questions like you described to verify that they're eligible. But people can also self-identify as eligible, and then they get put on a list. And that's where we talked a little bit about, because we had that originally locally, we had a survey where people could go in and self-identify. And in the metro area, we've identified about 70,000 people that still fit into phase 1A. And my understanding is some of the concern is that they're now going to have to go through this other newer OHA bot. And so they'll be getting information. My understanding is that they'll get an email that says, unfortunately, you have to go here and complete this form.
Yep. Well, and that was part of the broadcast as well, and different people being frustrated by the fact that they felt like they were having a do-over, and now there were more people in ahead of them in the line. And when I saw it on the television this evening, I was frustrated by that and trying to figure out, how did we let that happen? But then by virtue of that later walkthrough, I realized that in one case they were put on the list, but what this new system does is actually gets them to the appointment page, where, and the reporter showed us their ability to select the days and the time slots. So that is something that is a further advancement, and that's a good thing.
And a bit to the counties, not just Washington County, but many counties, we were trying to get ahead and understand what the demand was and who qualified. And so we all put up these surveys, and then the state created the system and the health systems, and everybody decided, which is true, it makes sense to have one centralized system. And so, yes, now it's frustrating to those 70-ish thousand people that did this other process, and now they're going to have to do it again. They are going to do it. It is a do-over, unfortunately.
Yep, it's hard, but the pump is primed now. So,
we hope.
Yeah.
Yes.
Well, and the last item is, I understand from multiple national news outlets that President Biden has committed through the U.S. Defense Production Act to buy a couple 100 million doses with a goal of getting all Americans vaccinated by the fall. So that is some pretty significant commitment there. And while it's going to take months for additional vaccine doses of those already manufactured, as well as some potential new company sources, it sounds like we do have a national agenda now to accelerate the doses. But in the meantime, it's slow going ahead for at least another month plus. We have a plan. It's an improved plan from what's been learned over the first 6 weeks. So I know we can do it. We just have to remain patient, remain diligent. Now wear 2 layers of masks. That's the new recommendation. Always wear, if you have a cloth mask as part of your double set, wear the cloth one on the outside, and your surgical mask or your KN95 on the inside. So that's it from me. Thank you very much for all of your efforts and that of the team. And onward, ho, we go together, trying to stay healthy.
Thank you.
Thank you again. And thanks for making your slides available on the website, social media, and on the YouTube channel.
Yep. Thank you.
Great. Well, next we'll move on to boards and commissions. And here we have 3 different roster sets tonight. The first one is to appoint members to the Washington County Fair Board. We don't usually have presentations of this. Tonight, we just have a recommendation and an action to appoint Gary or reappoint Gary Seidel to the Fair Board for a 3-year term ending December 2023. And I just want to highlight that Mr. Seidel has helped bring public safety knowledge to the Fair Board, which has been very helpful for the operation of the annual fair. Commissioner Willie, I didn't mean to steal any thunder. Was there something more you would like to share?
No, I wouldn't. I would completely agree with that. Gary brings a real leadership to the Fair Board as chair, and so I'm glad to see that we're reappointing him.
Do we have a motion?
So move.
And a second. Thank you, Commissioner Rogers. All those in favor, please vote by saying aye. Aye.
Aye.
Any opposed? The motion carries unanimously, 5-0. Thanks, commissioners. Next, the Fairgrounds Advisory Committee. And here we have a recommendation to reappoint Daniel Pearson and Stephen Nagy to 3-year terms ending December 2023 on the Fairgrounds Advisory Committee. These 2 gentlemen have been serving on the Fairgrounds Advisory Committee and bring a array of interest, everything from experience with the significant adjacent property with the Hillsborough Airport from the Port of Portland, as well as Dan Pearson as a community resident, works here in the Washington County area and is also an active member with the Hillsborough Chamber Board. Do we have a motion to approve the appointments as I summarized? Move approval, I see from Commissioner Rogers. Do we have a second from Commissioner Willie? All those in favor, please vote by saying aye. Aye.
Aye.
Any opposed? The motion carries unanimously, 5-0. Next, we have the opportunity to appoint our first ever members to our first ever salary commission. Mr. Steve March is serving as our consultant to help us in this area. Mr. March, would you like to present the roster for us this evening?
Certainly. Thank you, Chair Harrington. For the record, my name is Steve March. I'm acting as the facilitator consultant for your first ever salary commission. And we have a great slate of 5, I set my folder down, 5 selected, plus we had a 6th apply who's also qualified. And I'll just kind of overview their a variety of experience, both public and private and non-governmental sector. We've got a variety of education and training from specialized training in human resource management and organizational development, and most of them have gone through some certification programs for compensation and human resource development as well, and all the way up to one with a JD and was formerly a employment law attorney. So a great group of people. We had talked previously about the possibility of appointing the 6th as an alternate, and I hope you go ahead with that and do that. I can name them if you'd like, or okay. So one of our first applicants, Brianna Ekadam, and she is with Providence, and she is a person of color. So that's, I will say that all of these folks are women. So we had no male applicants, which is probably not too unusual for the industry. A lot of the human resource area tends to attract women. Maybe they're better with taking care of human resources. I've always been pleased with the ones I've worked with. The second one, Heike Kirkendall Baker. She is a assistant vice president for Lewis and Clark College for human resources. She's also the one that happened to have the Juris Doctorate, so and they did employment law. So great experience there. We have Casey Koronek. She's was with the state of Oregon for a number of years and's gone back into private sector and works for a company called Workplace Change LLC. And she spent, like I said, many years with the state and with both the Department of Education and Employment Division. We also have, I'm not giving you all of their resumes. It's, their backgrounds are, varied and almost, I think almost all of them have had some private sector experience in the human resource area. Laura Sampson, she is with Multnomah County. She has a very strong background and even was, no, she's not. So we have two people from Multnomah County, and the next, Laura is actually the current senior classification and compensation analyst, and she's working her way through a certified compensation professional degree. We have Susan Mullett, who's the other person from Multnomah County. She is the class comp manager. And before that, she worked for the city of Eugene and spent 3 years on their work in their employment compensation board for their elected board. And then we have the last individual that wasn't in the first five. The first five would be your salary commissioners. The last one is Suzanne Smith, and she's a recent resident of Washington County. They live out on the Bald Mountain area and south side of the county there. And she spent many years managing human resources for the city and county of Broomfield in Colorado. So new to Oregon, but if she is named as an alternate, we'll give her a good experience of Oregon government and compensation practices here. So thank you.
Thank you, Mr. March. So the board had the opportunity to discuss this slate in work session today. And so at this juncture, I would like to entertain a motion to appoint the salary commission members as recommended by Mr. March for 2-year terms through December 31, 2022. And in addition, to appoint Suzanne Smith as an alternate such that there is an alternate available for the purposes of stepping in to serve on the salary commission in the event that one of the 5 appointed persons is not able to follow through and attend with the work in these coming months. For example, we were talking about COVID and surprises that have been coming up there. So we wanted to help ensure that the salary commission is in the best possible position to get their work done on our behalf. Do we have such a motion tonight?
Here.
Motion by Commissioner Rogers, second by Commissioner Willie.
Yeah, I just make one comment, Stephen, and Commissioner Willie can probably tell you better, but to my recollection, we don't have a bald mountain. I think that you probably mean bald peak.
Correct.
Just for our viewing audience, we don't have anything like that.
Thank you. It's been too long since I've lived in Washington County.
So
And
I think,
I think the second was Commissioner Treese.
yeah. So motion from Commissioner Rogers, second from Commissioner Treese. Thank you. All those in favor, please vote by saying aye. Aye.
Aye.
Any opposed? The motion carries unanimously 5-0. Thank you, Mr. March
Thank you.
and commissioners. Next, that takes care of our board and commissions this evening. Next, we have one public hearing for tonight from Support Services. This is for a public hearing to approve the transfer of 2 county-owned properties to the city of Hillsborough. Before we open a public hearing, I assume, since we have some staff members who joined us, that we have a short staff report. So I'll turn it over to Jack Liang and to Greg. I can't remember your last name there, Greg. I'm sorry.
Wyman.
There you go. I'll turn it over to you two experts.
Thank you, Chair Harrington. Good evening, and good evening, commissioners. Thank you for your time to review this item with us. So this is, as the chair mentioned, it's regarding 2 properties that the county owns through the foreclosure process, and then we have received a request from the city of Hillsborough to transfer these properties for other public uses. And I will, this is something that I want to say that happen infrequently, but it's not uncommon that happens in the county. So I will pass it on to Greg to provide more details and then the county's process on this property transfers. Go ahead, Greg.
Thank you, Jack. Good evening, Chair Harrington, board members. My name is Greg Wyman. I am the real property manager for Support Services, Parks and Facilities. And as Jack mentioned, I will be presenting the staff report this evening on the proposed transfer of these 2 properties to the city of Hillsborough. Active management of real property portfolio is in the best interest of the county and the public, including the necessity to disposition surplus property. Surplus property, by its definition, is property with no use to its owner, in this case, Washington County, who receives no benefit from owning these properties. Washington County incurs costs to manage and maintain these properties, and the properties themselves are not put to the best use by the community. Therefore, it is generally in the public interest for Washington County to dispose of surplus properties as quickly as possible. The city of Hillsborough has requested the transfer of these county-owned properties for the continued use of green space. The size, physical characteristics, and designation as a significant natural resource area adjacent to a body of water limits the use and sale of these properties, while the county has continued obligations for maintenance. These properties are located within Hillsborough city limits and would be more appropriate for the city of Hillsborough to manage. Oregon Revised Statute 271330 authorizes any political subdivision to relinquish title to any of its property not needed for public use to any governmental body, provided such property shall be used for not less than 20 years for a public purpose by receiving governmental body. The statute requires the public use be perpetual and a reversionary clause be included in the deed, exercisable if the property is used for a purpose that is inconsistent with this transfer. The Real Property Management Guidelines adopted in 1991 and amended in 1996 allow property not needed for public use by the county to be transferred to another public agency. Staff recommends the request of this be approved by the board. For this transfer to be approved by the board. Excuse me. Are there any questions regarding the properties?
Commissioners, do we have any questions? No? So at this juncture, with no questions, I believe I don't need a motion to open a public hearing. So I'll just open a public hearing. Mr. Moss, do we have anyone signed up to speak to us during this public hearing?
We do not, Madam Chair.
Okay, well, with that, I'll close the public hearing. So we don't have any objections. Do we have a motion to approve the transfer of these 2 county-owned properties to the city of Hillsborough and authorize the board chair to execute the deeds with a restriction and revisionary clause?
So move.
And a second. Okay, we have a motion and a second to do so. All those in favor, please vote by saying aye. Aye.
Aye.
Any opposed? The motion carries unanimously 5-0. Thank you very much, Jack and Greg, for being here with us this evening. I hope you'll get home safely.
Thank you, Chair Harrington and board members. Have a good evening.
You too.
Thank you.
Next on our agenda is the action section. Here we have a half dozen actions tonight. So the first one is from the County Administrative Office to approve temporary funding formula change for conciliation and law library services for current fiscal year, as well as next fiscal year 2021-2022. And I see that we have Erin Calvert already. Welcome, Erin. Please, staff report, please.
Thank you, Chair Harrington. Good evening, Commissioners. Chair Harrington, for the record, I'm Erin Calvert with the County Administrative Office. I was last before you on this topic of the conciliation and law library funding in a work session on January 5th. And at that time, we reviewed the history of the funding for the 2 departments, which included the funding formula that the Board of Commissioners had approved back in 2012, after the legislature gave local allocation decisions to the Board of Commissioners, and then later codifying the rules around the allocation in the Oregon Revised Statute 9.829, stating that in consultation with the presiding judge, an allocation could include up to 1/2 of the monies distributed by the state for purposes of operating a law library or providing law library services for the purpose of providing conciliation and mediation services in the circuit court. And so in addition to the formula review and the history that we went over, we also discussed each program's financial projections given the state's reduction to the law library this fiscal year. And then both in the context of the current formula, as well as if we return to the state appropriations, we reviewed both of those projections. So given the projections and the information that we currently have, staff are making a recommendation at this time and a request that your board take action to approve a temporary funding formula change that would return to state appropriations for both departments. We're asking that this change be effective for the current fiscal year and the next fiscal year, 2021-22. And then I would note for the board that the plan was for us to return to you in January of 2022, which seems so far away, but really it's just a year from right now. And that we would review again, kind of more information as it comes up from the state appropriations, as well as the new formula if the board wanted to look at something different. And then I just also wanted to note that the board did you all made a request of us to talk with you in more detail at a later time about program services, community need, and the impact of those services, as well as the impact in any type of service reduction or change. So that will be coming to you as we learn more as well. And that concludes the staff report.
Do any commissioners have questions on tonight's staff report? Okay. Seeing none? Okay.
Thank you. I don't have a question. I have a comment to say it's nice to match your name to a face, and I know we talked last week, so I just wanted to say thanks for the call.
Agreed. Thank you, Commissioner Fye. Appreciate that.
Yes, and who knows? Maybe by January of next year, we'll actually be able to meet face to face.
That would be fantastic.
And Nafisa, if you ever get into the office, Erin has a great little bowl of candy nuggets that is available anytime you need to. I've visited on regular occasions, so
It's
anyway,
true.
just remember that.
Jerry knows me very, very well. I'll be making sure to hunt those candies.
I'll learn your favorites.
I haven't gone to her office for candy yet, but I've certainly been a frequent visitor for learning more about the whole realm of public safety.
With that, motion to approve staff
Great.
recommendations.
And we have a second. Great. So we have a motion and a second to approve the temporary funding formula to utilize the state appropriations to the respective programs. That would discontinue the current or prior 60% formula distribution to conciliation services and 40% to the law library. This will be a temporary formula effective for this current fiscal year remaining 2020 and 2021, as well as next fiscal year 21-22. And as Aaron mentioned, staff has committed to come back to us about this time next year to update us on options and actions for subsequent fiscal years. All those in favor, please vote by saying aye. Aye.
Aye.
Any opposed? The motion carries unanimously 5-0. Good to see you, Aaron. Thanks for joining us.
Thank you.
Next, we have an action item. And this will be the first read of an ordinance. So first I need a motion to please read ordinance number 871 by title only. We have a motion. Do we have a second? Great. Thank you, Commissioner Treese. We have a motion by Commissioner Willie, a second by Commissioner Treese to read ordinance 871 by title only. All those in favor, please vote by saying aye. Aye. Thank you, commissioners. Motion passes 5-0. Mr. Rapelier, could you read it by title only, please?
Sure. Ordinance number 871, an ordinance amending Washington County Code Chapter 8.04, solid waste control relating to solid waste and recycling advisory committee.
Terrific. And we have Ms. Marnie Kyle here for a staff report. I think.
Good morning or good evening, Chair Harrington again.
Look, turn right around, Marty, and look, it's dark outside, but I know you're one of the morning people like Commissioner Rogers.
But it's dark when I wake up like Commissioner Rogers at 5 in the morning too, so I get confused. Actually, I believe that Tom Eggleston is on with us and he was prepared to give a staff report. And
oh, I see him there under attendees. Could we advance him, please?
Thank you. I was hoping he was one of the boxes with just no name, but there he is. Great. Thank you. I'm glad you're here, Tom.
Thank you. So we just have a quick brief staff report this evening. We have a first reading and we will have a more robust staff report public hearing discussion at the second reading. So I'll give a quick overview. Good evening, Chair Harrington, commissioners. Thank you for having me here tonight. This evening, we're introducing ordinance number 871, an ordinance amending Washington County Code 8.04 as it relates to the Solid Waste Advisory Committee. As part of a countywide effort to incorporate equity considerations into boards and commissions, Ordinance 871 proposes changes to the creation, membership, meetings, and duties of the Solid Waste Advisory Committee. Throughout the summer months of 2020, staff hosted several listening sessions with stakeholder groups, including the current committee, the Civic Leaders Program, Master Recycler Volunteers, environmental promoters, and the Washington County Haulers Association. Staff also evaluated approaches for incorporating equity considerations into advisory committees taken by other committees and agencies, including the Public Health Advisory Committee and Metro's Regional Waste Advisory Committee. In accordance with your board's equity resolution, Resolution Order 2030, Ordinance 871 is intended to advance equity by providing intentional access and opportunity for community members from historically marginalized groups to engage in the solid waste decision-making process. Proposed revisions to this ordinance, as detailed in your materials, include adding language to clarify the purpose of the committee, changing the name of the committee to the Garbage and Recycling Advisory Committee, increasing the number of public member positions from 6 to 9, reducing the number of solid waste industry positions from 3 to 1, making the solid waste industry member position non-voting, retaining the Health and Human Services member position as non-voting, reducing the membership term from 5 years to 4 years, adding term limits to provide no more than 2 successive terms of membership, ensuring recruitment and selection processes are open to all segments of the community and include equity considerations, adding a provision that your board shall adopt bylaws governing the committee, and amending the duties of the committee to remove more technical terminology and align it with its purpose. Staff is recommending that your board conducts a first reading by title only of this ordinance and continues to February 16th, 2021 for a second reading and first public hearing. Thank you.
Thank you, Tom. So we've already had the reading of it, and now I just need a motion for us to continue this for the second reading and first public hearing to Tuesday, February 16th. Do we have such a motion?
Chair, I have a question.
Oh, certainly.
Okay. I'm not in favor of a couple of these things. So at what point in time do I either make a motion to modify that, or how do I go about voicing my opposition to a couple of points?
Well, you can do so tonight, but in addition, you can also, we can have the public hearing on the 16th, and you can make a motion for amendments and so forth.
Okay, I don't want to exclude the ability for me to be able to do that. So if I need to do that on the 16th, so be it.
Yeah, yeah.
I would comment that I have a concern too with the membership. That I've broached that before. I would like one more industry member in there just to balance it out. But I think the appropriate time is at the hearing.
So just for the viewing audience, the way some organizations work is if you have an issue on an ordinance, you need to state that and vote as such on the first reading as opposed to the second reading. Our process allows for that to be done in either way, but you don't have to mirror. You have through the motion for final adoption of an ordinance to express your satisfaction or displeasure through your vote. Okay. Do we have a motion to, if we have a motion to continue this for a second reading and first public hearing to Monday, February 16th? Do we have a second? I might have missed it as I was looking down.
Commissioner Treese did it.
Yeah.
Okay. Thank you. All those in favor, please vote by saying aye. Aye.
Aye.
Any opposed? The motion carries unanimously 5-0. So we'll continue on with the process then. The next action is to introduce and do a first reading of another proposed ordinance relative to the solid waste and recycling. So do we have a motion to read ordinance number 872 by title only? We have a motion. We have a second. All those in favor, please vote by saying aye. Aye. Any opposed? The motion carries unanimously 5-0. Mr. Rapplier, please.
Ordinance number 872, an ordinance amending the Washington County Code, Chapter 8.08, Solid Waste Disposal Sites relating to the Solid Waste and Recycling Advisory Committee.
Mr. Eggleston, would you like to make a brief staff report?
Yes, thank you. Good evening, Chair Harrington, Commissioners. Again, this evening we are also introducing ordinance number 872, an ordinance amending Washington County Code Chapter 8.08 that as it relates to the Solid Waste Advisory Committee. Ordinance number 872 is closely related to ordinance 871, except that it relates to the Solid Waste Disposal Code, Chapter 8.08. Many of the proposed changes included in this ordinance are complementary to those in ordinance 871. The details outlined in 871 in regarding to membership and the structure and design of the committee is included in Chapter 8.04, not 8.08. This ordinance, as detailed in your materials, would add language to clarify the purpose of the committee as it relates to solid waste disposal, change the name of the committee throughout the Solid Waste Disposal Code to the Garbage and Recycling Advisory Committee, amend the duties of the committee to remove more technical terminology and align it with its purpose, delete references to past practices, and note that many of the committee details reside in Washington County Code Chapter 8.04. Staff is recommending your board conducts a first reading by title only of Ordinance 872 and continues to February 16th, 2021 for second reading and first public hearing. Thank you.
Are there any questions or comments from commissioners? No. Do we have a motion to continue this to February 16th for the aforementioned second reading and first public hearing? We have a motion. Do we have a second? We have a second. All those in favor, please vote by saying aye. Aye.
Aye.
And any opposed? The motion carries unanimously 5-0. Thank you, commissioners.
Madam Chair, just for the record for the public, this will be Tuesday, February 16th. You mentioned Monday, so just for the record, it's Tuesday.
Thank you so much. Let the tongue get tied. Thank you, Tom. Take care. All right. We finished the Health and Human Services 2 actions. Next, we'll move on to Housing Services. To approve another affordable housing bond concept endorsement for the Salzman Road Senior Apartments project. So do we have Mr. Calavar?
Yes, we do. Good evening, Madam Chair Harrington and Commissioners. My name is Komi Calavar. I am the Director of the Department of the Housing Services and also Executive Director of the Housing Authority. We are with you this evening to share information about the Salzman Road Senior Housing Project and request concept endorsement for the use of affordable housing bond for this affordable housing development. As you know, the Metrobond was approved by voters in November 2018. The bond yielded $752.8 million to be invested in the production of approximately 3,900 units of affordable housing in our region. Washington County is one of 3 implementing jurisdictions in our county. The cities of Beaverton and Hillsborough also received their own allotment of bond funding. The portion the county is managing is $116.5 million, and our goal is to produce 814 units or more. Well, we hope we can do better. The county currently has 9 affordable housing bond projects underway. These 9 projects total 759 units. The county's phase 1 project, which is the Viewfinder, is under construction and is scheduled to be completed by October of this year. 7 projects that your board approved for concept endorsement last fall are also in process. All the projects applied to our notice of funding, which was issued in March, and are proceeding as planned. The Aloha Inn, which is a 54-unit permanent supportive housing development involving the conversion of a motel in Aloha, which is in unincorporated Washington County. I'm happy to report this evening that the Housing Authority successfully closed on the acquisition of the Aloha Quality Inn today. So, thank you. The Salzman Road is a strong addition to this portfolio of affordable housing developments. The Salzman Road project contributes to geographic dispersal of affordable housing in the county because it's located in the Cedar Mill area of unincorporated Washington County. The project's initial application had some shortcomings, which the committee instructed us to work with the team through. We are happy to report that the development team has been very responsive, and we are at a point now where we want to present it to you for concept endorsement. With that, I'll hand over to Shannon Wilson that would walk you through more details of the Salzman Senior Housing Project. Shannon?
Welcome, Shannon.
Hello, good evening,
There
Chair
she is.
Harrington and Commissioners. Thank you for the opportunity to be with you this evening virtually. My name is Shannon Wilson, Housing Development Manager, and I'm here to provide an overview of the Salzman Road Senior Apartments and as a request for concept endorsement for affordable housing bond funds. So this project will provide 53 units of housing. There you can see the unit mix of 1-bedroom and 2-bedroom units. And this project is a partnership between Home First Development and the Christ United Methodist Church. So the church actually owns this parcel of land in Cedar Mill, and Home First is an experienced developer in the Portland area. This will be their first project in Washington County. Next slide, please. So here on this slide, you can see a map of the area, and you can see the project there is indicated by a purple house icon kind of near the center of the map. And you can see that directly across the street from the project is a Cedar Mill library, as well as a TriMet bus stop for line 50. And the site is also less than a quarter mile from the TriMet stop at Cornell Road in Salesman, which is a stop for lines 48 and 62 of TriMet. And then as you look to the west on the map, that kind of orange area is a large shopping center with a grocery store, several restaurants, other services. And then across Cornell Road, still in that orange area, is a recreational area with an indoor pool, as well as some ball fields, and as well as walking paths. So it is a very well located site near a lot of great amenities for individuals of any age. I also want to highlight here this site in considering our overall goals with implementation of the Affordable Housing Bond Program with regard to geographic dispersal. This is the only affordable housing bond project to date that is north of Highway 26. And so, so it plays an important role in that aspect of bond implementation as well. Next slide, please. So as Comey mentioned in his remarks, this project initially applied for funding in the county's NOFA process, Notice of Funding Availability, last year. And at that time, the evaluation committee recommended that the project consider making changes in 4 key areas. And those are the ones you see there on the slide. So ownership structure, advancing racial equity, the unit mix, and construction costs. And so the committee encouraged staff to work with the developer to address these areas and then to bring this updated project back to your board for consideration in the future. And so for the past 4 months, we have been working with the developer to address these items. And I do want to comment that both Home First and the church have been very amenable and receptive to this feedback and considering their approach with the project. So I wanted to highlight that. So with regard to ownership structure, Home First is now going to be not just the developer of the project, but also the long-term owner and operator together with the church. So prior, Home First was going to develop the property and then the church was going to operate it over time, but the church, the committee recommended that an experienced owner and operator of regulated affordable housing be involved in the project long-term. And that's really important because it places a project on stronger footing to be successful over the 60-year period of affordability. With regard to advancing racial equity, Home First has reached out to Bienestar, which is a local Washington County-based affordable housing developer and resident services provider. And so Bienestar will be providing resident services at this property. With regard to the unit mix, we asked the developer, the development team, to consider the unit mix, the number of 1 and 2 bedrooms with regard to their target population of senior individuals. And so they reconsidered that and came up with a mix that was viewed as more appropriate for that population. And then construction costs have also been updated by the development team, and those costs have also been reviewed and evaluated by our third-party financial analysis consultant. And so in addition to construction costs, also looking at the operating cost, you know, over the long term as the project is built and is operating. And what they were looking for is costs that are really sufficient to build a very durable project, both with regard to materials and finishes, and then also that the operating cost has sufficient, the operating budget has sufficient reserves so that over the life of the project can ensure that it is sustainable during that time. And so next slide, please. So this slide gives you a snapshot of the funding and then also the timeline for the project. There you can see the sources and uses broken out of the project. So total development costs of $12.365 million for this 53 unit project. excuse me, you can see the uses there broken out as well. And then on the right, you can see the estimated timeline. And so that has early this year concept endorsement to be considered by your board and Metro. And then later in the year, the development review process, and then returning early next year for final approval from your board and Metro. And then that should be a May 2022 construction start. My apologies for that typo. And then with completion in July of 2023. Next slide, please. And so this slide puts the Saltsman Road Senior Apartments project within the context of the county's work overall in the Affordable Housing Bond Program. And so you can see the chart starting on the left-hand side. The column in blue are the Metrobond framework and county goals, some of those that Comey mentioned. And so you can see all the different goals that we have started out with and the capital funds. So you can see kind of where we began. And then as we move through the chart, the different projects that have been approved by your board and are moving forward. And so there in the orange, you can see the Saltsman Road Senior Apartments project, which we are here before you tonight. And so you can see the total number of units there as 53. 30 of those units are targeted to serve extremely low-income households at 30% median family income. 9 of those units are family-sized, 2-bedroom. And then 23 of the units are anticipated to be permanent supportive housing units. And then you can see the total request in Metrobond funds of just under $6 million for this project. And as you continue working across the chart, you can see in that final row, or final column, excuse me, the remaining goals and funds. And so you can see with this Saltsman Road Senior Apartments as our the county's 10th Metrobond project, that the county is very well positioned to meet and even exceed the unit production goals for the affordable housing bond. And so with that, I thank you for your time, and we are happy to take any questions or comments that you might have. Thank you.
Commissioners, comments, questions? Commissioner Treese?
Thank you. Thank you, Shannon. Thank you, Comey, for bringing this forward. It's really very exciting, very exciting. So please, make sure that I know if you're running into any barriers or any issues. I'm sure all of us would feel the same way, but I'd especially like to see this happen. And I'm so glad that wasn't 23 that you were looking at.
Yeah, 22.
So good. Thank you very much.
Commissioner Willie?
Yeah, I'd just like to echo the same thing, Comey. Your team has done a great job on this, and this is quite frankly really impressive. The way that we have been able to get this money into play in a very efficient and quick fashion, and it's really testament to your commitment to this and so your expertise. And so congratulations on this, and please pass that on to your team. I just want to make sure I understand the last column of the last slide that you showed there. Well, we've got about $16.6 million left over to meet or exceed those remaining goals and funds. So 2 units, 22, 30% MFI units, 11 family-sized units. So we've got $16 million to go. I'm assuming that we're going to be able to meet or exceed expectations on this money. Am I correct in that?
We think we'll be able to meet or exceed it. Yes.
All right. Well, yeah. when we get ready to do that, Comey, we're going to put out a PR blitz on this, because this is something that I think the taxpayers need to absolutely hear, that we took care of money that they committed to us for this particular purpose, and we did it in great fashion and certainly in a timely exercise. So I'm all in for that. So good job on that. Thank you.
Thank you, commissioners.
Also in a great location.
Yes. We've been working quietly behind the scenes, trying to make sure it's spread out in all corners of the county. And speaking of a media blitz, I want to quickly mention that the $99.8 million in Metrobond has leveraged a total of 271 million in total development costs. That could create approximately close to 1,500 family wage jobs. So that's economic development. And that's, and obviously at the end of the day, we'll try and get lawyers, engineers, architects, geotech, all of those things, put that in a nice summary, but it's some of what we are working on right now, but the economic development part of housing, because that's a huge investment, 271.5 million in economic activity in Washington County.
That's it. That's even a more impressive statistic, Comey. So thank you for pointing that out. And probably some of that money went to accountants to do whatever it is the accountants do. I don't know, but
lawyers, lawyers especially. Yeah.
Those bean counters, they got to be in there somewhere. So
yeah.
Commissioner Rogers, was there something you wanted to share with us as well?
No, not at all. Every time I talk about Comey, his head gets about 8 times bigger. So I'll just stop. You know how I feel about you. You've done just a terrific job. So
thank you, commissioners.
It's a great project.
Commissioner Fye, I know you've come up to speed very quickly on a lot of things that the rest of us have had the benefit of a good year to 2 of experience. So we went through the original notice of, I can't remember what the F&A means. Finance availability, funding availability.
Notice of funding availability, yeah, NOFA.
Thank you, Comey. And the original slate of projects, this is one that has come back in. Are there any questions or comments you might have this evening?
No, I just, from what I read, I echo everyone's excitement. I'm definitely excited for Commissioner Treese. This is happening in District 2 and excited. And I like the part that, that the median income, family income, it's pretty low. So I appreciate that. So I think there will be a lot of people that could qualify to be in those. So good looking out for our residents and that.
Happening in District 2, but it's available to everybody. So I'm really pleased about that. And I also know that we have other people that are watching and online at the state level who are also very encouraged by this and we have their support as well. So thank you to everyone.
Well, I'm at opportunity. I am not at all surprised that our great housing team has persisted in practicing the art of the possible, in continuing to be engaged with the Christ United Methodist Church and Home First to get the areas of concern revisited and addressed. I am also just absolutely delighted to see that this project has a target population for our LGBTQ seniors. I met with a group of service providers for those members of our community a couple of months ago, who have had the opportunity of affordable housing for retired seniors from the LGBTQ community based in Multnomah County. So it's just absolutely thrilling to me that we have such a solution proposal here in Washington County. So job well done to the team. And you make it so easy for us to say yes and approve these final projects because you are so thorough in the work that you do on these agreements and in presenting these opportunities for us. So at this point, commissioners, I would love to entertain a motion to approve the concept endorsement for the Salesman Road Senior Projects.
So moved.
Do we have it? We have a motion from Commissioner Twilly. Treese, and a second from Commissioner Willie. Whew, boy, talk about tongue-tied tonight.
I don't know about Commissioner Twilly. You know, that's like one of those celeb names, and I don't like that.
I am so sorry, but I'm really glad to provide a little levity for tonight's meeting.
That's going to go into infamy. I'm sure that one's going to make the records. I tell you.
That goes right up there with the washing machine story. Okay, all those in favor, please vote by saying aye. Aye. Any opposed? The motion carries unanimously 5-0. And believe me, our laughter here does not in any way diminish from the incredible accomplishment of approving this a new opportunity. So thank you very much, Comey, Shannon, and to all the other members of the team. Thank you.
Thank you, Chair and Commissioners. Good night.
Take care. We're on to, we're in the home stretch. We now have 2 remaining action items from the Land Use and Transportation Department. The first is to approve a resolution concurring with increase in maximum indebtedness of the Tigard City Center Urban Renewal Plan. We did have a proposal on this in a work session just a couple of weeks ago, but I believe we have a short staff report for tonight as well. There we go. Hello, Mr. Roberts.
Good evening, and thanks for the chuckle just now. That was
Oh.
after a long meeting. So Chris Steffenbach is gonna just run through a pretty brief presentation. You all had the benefit of hearing from representatives from the city of Tigard on this at your work session 2 weeks ago. Tigard is proposing a substantial amendment to its city center urban renewal plan. So in addition to Chris giving the staff report, we have Sean Farrelly from the city and Elaine Howard, who is the city's economic or urban renewal, I should say, consultant, all available if you have any questions or would like any additional information. So with that, I'll turn it over to Chris.
Thank you, Stephen. Yes, they are on standby if there are any questions. So next slide, please. So we're here today to request your support or approval of the resolution for an increase in the maximum indebtedness of the Tigard City Center Urban Renewal Plan. And the what this action would do was increase the indebtedness by over $20 million for a total of $42,800,000 and extend the last date to issue the debt up to fiscal year 2035. With the revenue sharing that is now required as part of state legislation, the estimated increased fiscal impact to the county is just over $6 million over this time period. And the reason that this request is coming to you today is that state legislation requires concurrence of taxing districts representing 75% of the permanent tax levies. So Tigard is seeking approval from you and other taxing districts. Also attached in your packet is a letter of support. So after the, with support from today, we can also submit a letter of support for the record for, along with the action. Next slide. So the City Center Urban Renewal Plan, Tigard voters first approved the plan in 2006. And since then, the city has seen many accomplishments, including new private investment, increases in assessed valuation, building improvements in downtown businesses. They've been able, the investments have been able to leverage additional private investment into downtown and for a variety of improvements, and included has also been multifamily housing units in the downtown area. In 2017, Tigard approved an amendment to increase the acreage of the area. Next slide, please. Here is a map of the area. You can see to the north on the up part of the slide, you can see Pacific Highway, you can see 217, Hall Boulevard on the main street, so you get a sense of the area. Next slide, please. So with the new increase in maximum indebtedness, after much input and discussion from the community and the city's advisory committee, the recommended projects that would be funded with this new expansion, and that the projects would include improvements to the public spaces, improvements for street improvements, new bicycle and pedestrian facilities, shared parking facility, and additional affordable housing, and more. Next slide, please. So as with all urban renewal areas and urban renewal plans, there's always a question about displacement. And Tigard has thought about this and is prepared to address it. In addition to the affordable housing projects that are included as part of the urban renewal plan, Tigard also has commitments to support affordable housing that'll reduce the potential impacts of displacement with a variety of tools and incentives, commitments to support affordable housing. City also has commitments to address business displacement, including matching grant programs and assistance to businesses, particularly historically underserved communities. So they are ready to have a plan to reduce any potential negative effects. Next slide, please. So the timeline for this proposal has been in December, the Tigard's Town Center Development Agency recommended approval. In January, the Tigard Planning Commission recommended approval. On February 9th, the Tigard City Council is holding a hearing for the purpose of adopting the substantial amendment at the city. And then with that approval, the proposed substantial amendment would be before the voters on the May 18th election. So just to wrap up then, what we're asking is your support for the substantial amendment so that the City of Tigard continue to move forward with these plans and investments. Are there any questions for us or for the City of Tigard staff and consultant?
I would simply say thank you to the City of Tigard for your presentation. I know the area well, living there. It's a great project, and I hope you all support it tonight.
I would just like to agree with Commissioner Rogers. Great project, great work, and thank you, Tigard, for your leadership on this.
And I'd just like to comment again, reflecting back on the staff report that we got a week or so ago. Commissioner Fye pointed out the fact of gentrification is an important part of it, and I thought that was a real critical perspective on it. So, and I know that the City of Tigard heard that, and so I just want to say great job on that. And yeah, this looks like a good project.
Madam Chair, if you'd like a motion, I'd move that we approve the action.
Great, we have a motion and a second. I would just like to add, as I fumbled with my mute button, that I found that the work session and dialogue that we had a couple of weeks ago was really very helpful in understanding the ins and outs of this as this proposal extends the program to include new projects. So we have a motion and a second to move forward with the resolution and a letter of endorsement for this increase in the maximum indebtedness of the Tigard City Center Urban Renewal Plan. All those in favor, please vote by saying aye. Aye.
Aye.
Commissioner Willie, are you still there?
He's voting yes. He's waving his hand.
Okay. Thank you. Okay, I can't see that on my side. Thank you. Any opposed? The motion carries unanimously 5-0. Thank you, Commissioner Rogers, for helping. I seem to have a little delay in my audio and video feed tonight. Great. Well, we have, we only had one action under LUT. This last one is from the Office of Community Development with Jenny Proctor. She's here with us to approve an amended fiscal year 2019 action plan to include an additional round of CARES Act funding under the Community Development Block Grant Program, CDBG-CV3. Take it away, Jenny Proctor.
Thank you, Chair Harrington and Commissioners. Again, for the record, my name is Jenny Proctor, Program Manager for the Office of Community Development. And for the public, just background, our office administers on behalf of the county annual formula grants under the Community Development Block Grant Program, Home Investment Partnerships Program, Emergency Solutions Grant Programs, all from the Department of Housing and Urban Development. This year as well, we've also been the recipient of program funds that are tied to the COVID-19 pandemic through these same programs. We came to your board in June and August for the first and second allocation of program funds under the CARES Act, passed back in March of 2020. And we're now back again for the approval of our plan for allocating the third piece of COVID-19 funding, $1,713,078 under the Community Development Block Grant Program. You may remember from prior presentations that we conducted outreach in early and late summer to hear from our project partner agencies about what the needs were for the communities that they serve. All of our allocation plans have been based on these consultations, on unemployment data, on job losses, on business losses, communication from the Racial Equity Collaborative and county departments. The approach that we have taken for the allocation of these funds has been to look at more systemic community-wide needs, and this has been done in consultation with the Department of Housing Services Homeless Programs Manager, who has worked closely with the Public Health Department since the pandemic began. Since the beginning, we've allocated significant funds towards rent assistance to help address the direct impact to households that have experienced job losses, reduction in hours, or other COVID-related impacts. We've allocated funds for micro enterprise businesses to ensure that there's technical assistance available with culturally specific services. We have supported street outreach to ensure that there is expanded capacity in our homeless system to ensure access points and navigation supports that lead people to safe places to sleep, through the severe weather shelter, through hotels, and through permanent housing. With this third and final allocation from the March CARES Act, we are proposing the following. With the end of the coronavirus relief funds as of December 30th, many of the existing resources, which are still so badly needed, were facing shortfalls and possibly the end of services. We looked at the need to continue funding the county's respite shelter, to continue the amazing work of the Department of Housing Services and Public Health, to ensure that people had shelter who were either COVID positive, were awaiting test results, or people who were exposed to the virus that needed a place to isolate. So we are proposing in our allocation plan $350,000 to support the county's respite center. We also looked at the need for the Family Promise model, which was showing amazing outcomes in moving people off the street and into hotels, and even in many cases into permanent housing. These entities were also funded with the Coronavirus Relief Fund, which again ended at the end of December. And it was clear that with COVID still active and in cases growing, we needed to continue to support that model of moving people off of the streets. We are proposing $400,000 to support the Family Promise programs. We propose funding community action with $583,078 for rent and utility assistance. We are proposing a small allocation of $40,000 to Micro Enterprise Services of Oregon and Adelante Mujeres. This amount will be combined with the funds that were awarded under the the first allocation of COVID funding, which when you combine those two amounts, that will give them 2 full years of funding. So the current year's funding and then funding into next year as well. Through our consultations with providers who serve those who are houseless, we've learned of the need for shower trucks in Washington County as well. We currently do not have any in the county, and providers do try to lease where they can. So we are proposing an allocation of up to $200,000 for the acquisition of a shower truck or trucks, and we are proposing to undertake a competitive process for that award. Finally, we're proposing $140,000 to support the administration of the grant. The regulations allow for up to 20%, but we felt that we only needed to utilize 8% of that award, and that allowed us to go a little bit deeper in support for projects. We completed a presentation of this allocation plan to the Housing and Supportive Services Network on January 6th. We held a 7-day public comment period and a public hearing in front of the Policy Advisory Board. There were no comments received through any of those opportunities. The Policy Advisory Board approved the allocation at its meeting on January 14th and endorsed it for submittal to your board for approval. So I'd be happy to answer any questions that you might have on the allocation plan. And there were 3 action items under that approval.
Commissioners, any questions or comments? I think we just heard Commissioner Rogers' approval on that. Anyone else? Do we have, go ahead, Commissioner Treese.
Just want to say thank you to Jenny. The presentation at the PAB board was excellent, and also the really hard work to keep the administrative costs down is a big plus. So thank you for that.
Yep.
Yeah, and I would certainly echo that. I mean, the fact that our administrative cost is 8%, we were allowed up to 20%, but we opted to redirect the money into programs that certainly was going to be much more beneficial to those in need. So this is an impressive list. Again, I continue to be very happy and also impressed with the way that we as a county have managed the CARES money. And I look forward to, quite frankly, an overall report of that $104 million. And I think it'll reflect that we have been good stewards of that money, and we've taken care of a lot of people and a lot of businesses in doing so. So good job, Jenny. This is a great way to kind of put the bow on that.
Just to clarify, that $104 million was CRF funding. This is not CRF funding. This is another aspect of the CARES Act.
Yeah, I get that.
Okay.
But again, these are programs that we are supportive of, you know, the people in need in our county. And so that's what helps.
Yep. Great. Great. So once again, I'll just add the thank yous and the comments, the fact that we're able to take advantage of this program with a smaller administration fee goes to the level of partnership, collaboration, and darn right efficiency of our great Washington County staff and partners. So thank you. So we have a requested action before us with 3 different parts to move forward with these CARE Act investments through the Community Development Block Grant Program, CDBG-CV3. Boy, I am awfully tongue-tied tonight. And to move forward with the HUD funding agreements for this award and to award the contracts to the Department of Housing Services and Family Promise affiliates as such. Do we have a motion? We have a motion. Do we have a second? We have a second. All those in favor, please vote by saying aye or signaling aye. Thank you. Any opposed? The motion carries unanimously 5-0. Boom. Good news. Good job there, Ms. Proctor. Thank you for joining us tonight.
Thank you. Thank you very much.
That brings us to the tail end of the action items and to our second oral communication section for this evening's meeting. Mr. Moss, do we have anyone signed up?
We do, Madam Chair. We have Kumar Nararaja. Kumar, can you hear us?
Clerk Moss, can you hear me?
Yes, we can.
Yes.
Please go ahead for up to 5 minutes.
Thank you. Good evening, Chair Harrington and Board of Commissioners. Thank you for providing me this opportunity for oral public testimony today. I am back, and for the record, my name is Kumar Naharaja, been a resident of Washington County since December of 2017. As a patron of the Washington County Law Library since that time, I wish to provide public comment on the CAO's move to approve a temporary funding formula to utilize the state appropriations to the conciliation services in the law library and discontinuing the 60% formula distribution to conciliation services and 40% distribution to the law library effective this current fiscal year 2020-21 and the next fiscal year 2021-22. I'll present this testimony in 3 parts as I joined this meeting late and I understood that this item has already been discussed a little earlier. So what I understood from the perusing the agenda packet is that the state allocation originally allowed up to 1/2 of monies distributed by the state for purposes of operating law libraries and providing law library services to be redirected for the purpose of providing conciliation and mediation services in circuit courts. The agenda packet also states that since 2012 through fiscal year 2019-20, over $400,000 of law library funds have helped to car conciliation, and this represents nearly 1 year of the law library's operating expenses. The second item I would like to present is I request the CAO to amend the additional information in the agenda packet under community feedback, no known community support or opposition. I request the CAO to amend this as I'm providing the public comment today. An opportunity for public comment was not provided to me earlier as it was not posted in the Washington County, Oregon Law Library's official website. And I came to know of this only through today's agenda packet. Now coming to my testimony, as a public member and patron of the Washington County Law Library, I support the total allocation of any monies distributed by the state for purposes of operating law libraries or providing services entirely and solely for use by the county law library. The practice of redistributing law library monies to conciliation services should be reconsidered in the light of the fact that the existing law library collection has outdated legal print resources. And it appears the law library has not taken adequate steps or efforts to update the law library legal research resources. For example, the addition of Matthew Bender products to LexisNexis online subscription and upgraded to a Lexis Plus subscription is much needed. To illustrate this point, the last update to Moore's Federal Practice Civil, which is a much referenced legal treatise in federal courts, it stands at 2017. Ms. Laura Orr is an illustrious librarian, the former librarian of Washington County Law Library, who is a very good advocate for public patrons. And I quote Ms. Orr's statement as it is not out of place in context here. Ms. Orr states, access to justice is a constitutional right guaranteed under Article 1, Section 10 of the Oregon Constitution. Access to justice involves more than simple access to the courts. In our legal tradition, access to the courts must include equal access to updated and authenticated sources of law. Access to justice without access to information is meaningless, and each Oregonian should have equal access to legal information and legal research assistance. So if money is distributed to the state by the state for purposes of operating law libraries or providing law library services continue to be redirected for other purposes, for example, conciliation, mediation services, and circuit courts, then likely the Washington County Law Library will be relegated soon to the status of a museum with an antique collection. I therefore request the board to direct the law librarian to upgrade the online subscription to online legal research databases such as Lexis Plus by adding Matthew Bender products and Westlaw online platforms, in addition to investing on updating the print editions of reference legal treatises. It's not known how the county council operates without access to these materials, Matthew Bender products, which are like the tools in everyday practice. Please consider my testimony, and I respectfully request your action. Thank you.
Thank you, Mr. Naharaja. I appreciate hearing your comments, and I know that Ms. Angie, our County Administrative Officer, will follow up on our staff with regard to the level of material access, as you have mentioned here this evening. The action that we took this evening, as well as covered more extensively in our work session on January 5th, gave more of an overview with regard to the history of law library and conciliation services funding available through the state. We directed our staff, as they requested this temporary change, to implement this temporary change, but also to do further investigation about the needs for both the law library and conciliation services, and come back to us after further investigation by January of next year for further consideration in the subsequent fiscal year. So part of the complication is how services, the service need, the expenses for the services have exceeded the available funds provided to Washington County from the state of Oregon, and are making the hard choice to, within the allowance of the state requirements, make some adjustments so that we don't have to make additional service cuts. So we will make note of your opposition to our earlier action as part of our meeting record for this evening. But I want to thank you again, and I appreciate your continued follow-up on paying attention to our work. And we'll try to make sure that as we have further information, I'll work with my office to try to make sure that you have advanced notification of when we have such topics come before us in our work sessions, as well as in our future business meetings. Thank you. Mr. Moss, is there anyone else joining us this evening?
There is not, Madam Chair.
Okay, thank you very much. And thank you to Mr. Moss for the follow-up that I know that you'll do in updating the record for this evening's meeting. Okay, next we have board announcements. And as usual, I'll make sure to do the future meeting announcements. Next week is a new month already, the month of February. The first Tuesday is February 2nd. We'll have a set of board meetings. Our work session will start at 8:30 in the morning, followed by our business meeting at 10 o'clock, and then reconvening the work session. Just a couple of days after that, we'll have our monthly board member roundtable that is expected to start at 9 a.m. versus 10 a.m. So we'll need to make that correction. The following Tuesday is a work session only. That is one where I will be attending from away. So Vice Chair Treese, if you could please run that meeting. I don't know what the state of affairs will be for my Wi-Fi access, but I do know at a minimum I will have audio access. So sorry about that. Then on Tuesday, February 16th, this is the Tuesday after the federal holiday weekend of President's Day weekend, we'll have a pair of meetings, work session 8:30 a.m., board meeting 10, and the work session will reconvene later that morning. Then the last set of meetings for the month, Tuesday, February 23rd, just like today, work session starting somewhere maybe as early as 1 p.m. if we need to adjust the meeting, otherwise standard time at 2 p.m. and a board meeting in the evening. Are there any other board announcements for tonight? Nope, nope. All righty then. Do we have, that brings us to the end of the meeting. Let me just double check if there's anything from leadership. No? Okay, just checking in.
So
All right.
Madam Chair, we have reflected the 9 a.m. start time for your February 4th roundtable on the website for you.
Okay, thank you. Do we have a motion to adjourn tonight's meeting?
So move.
Do we have a second? And we have a second. All those in favor, please vote by saying aye. Aye. Any opposed? The motion carries unanimously, 5-0. Good night, everybody. Thanks for putting up with my tongue twisters tonight.
Right.
Everybody be safe. Take care.
Have a great evening, commissioners.
Bye-bye.